Hi, I'm here with Scott Johnson. He is the CEO of PsoriaShield, which is a subsidiary of Wellness Centers USA. Thanks so much for joining us.
Thank you for your time.
Of course. So tell me a bit about what I see here.
Okay, well, PsoriaShield, we design, manufacture, and distribute this device, our flagship product, PsoriaLite. It's targeted ultraviolet phototherapy. So in a nutshell, that means we deliver very high dosages of ultraviolet light only to affected skin tissues, and we achieve rapid clearance or repigmentation or general healing in certain disorders like psoriasis, eczema, vitiligo, and many others.
So what is, you were telling me earlier, the cause of psoriasis and eczema, etc., happens to be from autoimmune issues. So how does this help with those issues?
Right. So the immune system, let's take psoriasis for example. The immune system is overreacting to some stimulus.
Right.
It creates a downward spiral. The immune system sends a bunch of T cells to the site of the supposed injury. Those T cells say, you know, heal, rebuild, etc. That triggers the cells which alert the immune system in the first place to send more T cells. You get this downward spiral. So ultraviolet light does a number of things. It dampens, it calms that immune response down just at the affected tissue. It's not a systemic effect. It's not like you're taking a biologic drug or something like that. It's calming that down. It's got enough energy to kind of destroy or denature the abnormally proliferating skin cells. In the case of psoriasis, it dampens the ability of the immune system to signal those new T cells to come in the first place, and it suppresses the immune response into the deep skin. The end result being that the skin itself will heal naturally back to its normal state. So we're just kind of shutting off the immune system locally, briefly.
Great. Well, let's see how it works.
Okay, quick demonstration.
Yes.
Okay.
Please.
Okay, so this is PsoriaLite. It's a touchscreen software. We've done everything we can to eliminate paper in the clinic. It stores electronic records and actually provides those via a USB port as a PDF report for clinics, for electronic paper records, that kind of thing.
Okay.
When a patient comes in, we're going to tap new patient. This should take about a minute. Skin type. We'll use my skin type, which is a very light. We decide
always burns is what it says.
Always burns. We'll use ultraviolet A, and assume, let's say we're treating eczema. And there's just general tabs, patient information, drugs, certain tests.
Great.
Images, this is something, it's patent pending, it's unique to our device. But we have incorporated, you're actually on video.
Ooh, hi.
Hey. We have
So
incorporated
cool.
high definition, a true high definition video camera right into the handpiece.
Oh, wow.
Why is that important?
Right.
Patient compliance, in a word. So let's say you have disease on your hand. We're treating your hand. You can see that progress over time. You can feel it. You know what's happening. With patients, and most of them have disorder where they can't see it in the mirror. It's behind the ears, scalp, skin folds, back of the leg, something that you can't see it. It's nice to be able to compare before and after pictures as you go.
Right.
And it keeps those patients coming in. It keeps the doctors not only treating that patient, but generating revenue. So it's important. I'm not going to take a picture here, but I will take a picture in a patient I've already set up. And then you'd save it. And it's stored to permanent memory. So that takes about a minute on the first treatment. And then we proceed into a treatment session.
How many treatments are typically needed?
Depends on the disorder type, and it depends on your lifestyle. So if you were born to have psoriasis, you've got the genetics, but very often it's environmental factors that bring out the disorder,
Right.
the presentation. Stress is a huge one. Food and allergens are enormous. Contact irritants like soap, hard water, etc. A number of things affect it. So depending on all of that, in general, psoriasis is going to achieve significant clearance in 6 to 10 treatments.
Okay.
Eczema can take more, 10 to 15. It's a more complicated disorder. Vitiligo, we've had amazing results with vitiligo, between 10 and 12 treatments for repigmentation. But inside of a month, 4 weeks, you should be a much, much happier individual without any biologic drug toxicity issues or steroids and that kind of thing.
Great.
So, I'm going to select luckily patient 13. Goes to imaging. The controls are kind of internet-based, back and forward. But I'm going to call up. Let's say this is the first treatment that we did, and we say, okay, here you are today. Wow, that looks pretty good. How do you feel about that? Well, the itching's gone. I can use my hand, very well now again. Typing isn't an issue.
Right.
So I'm working better. But
so there's literal progress.
Yeah, that side by side is pretty incredible. All right, that's great. What did the doctor do right there? They just reinforced the efficacy of the treatment regimen. So they're going to come back and they're going to tell their friends, and all of this is good for business.
Right.
So, if we were actually doing a treatment, I'm just going to take a picture. You just pull the trigger, press and hold. It's stored to permanent memory, and all of these things come out on the electronic record, the PDF.
Wow.
So we go to scoring. We're not going to worry about that. Dosage, we adjust the dosage up and down depending on treatment results.
Right.
But calibration, so the device calibrates itself automatically. We're going to kind of cheat a little bit, but this device is set at a very low intensity and a very short pulse. It's kind of safe. Normally we would be wearing UV safety goggles, the patient and the healthcare provider. But
so I shouldn't be worried right now.
Don't be worried. Well, and one of the key points of the system, it's not a laser. There is a class of laser called excimer laser, which are the forerunner to this technology. They only do UVB. They only treat psoriasis for the most part, maybe vitiligo in terms of insurance reimbursement. There's a lot of safety issues with that.
Right.
Now that we have deep UV LED technology, it's a first in the world to use these deep UV LEDs for this kind of therapy. It's not coherent light, so if you fire a laser from here all the way across the room and hit someone in the eye, they've got a problem.
Right.
LEDs, about half an inch from this window, and there's no intensity whatsoever. So I think we're safe. This is my favorite demonstration tool. It's Frisbee. It changes color with UV light.
Okay.
So I'm just going to fire a dosage into the Frisbee, and you can see that little square pop up.
Yeah.
So, people with disease over their whole body are not going to do targeted phototherapy. They're going to do like a big standing tanning booth.
Right.
They call them light boxes. But for people with the acute disease, in the scalp, they can't sleep for years. It affects the whole family. Under skin folds, they're an athlete where they're walking every day. Feet and hands, very difficult.
Right.
In certain other areas, they're not only physically debilitating, they're socially debilitating. They drastically affect quality of life, which is why these patients go and take biologic drugs.
Right.
They're that desperate for this clearance. So we're actually treating a relatively small treatment area, but let's just say it's the back of your hand, very socially obvious, it bothers you, etc. So you just build it out in blocks.
Oh wow.
You can see as you build it out, you're going to just go in this block pattern, and so on and so forth.
Until the whole area.
Yeah, let's say for a lot of patients show up with disease presenting on their knees or on their elbows. That treatment should take 3-4 minutes to treat, and they're gone. They're going to come in 3 days a week for 3 to 4 weeks.
Great.
And at that point, they've achieved enough improvement to where they might come in once a week until they're personally where they want to be.
Nice. So what's the ROI on the machine?
That's a good question. So Psorialyte takes advantage of 2 different billing codes. Billing codes are what doctors file to get reimbursed from insurance. These billing codes are readily reimbursed by Medicare and private insurers for Psorialyte. So, it really comes down to how many patients are you seeing and where you located geographically, because these billing codes are adjusted for geography. It will pay much more in Beverly Hills than it will pay, say, in Tampa, Florida.
Right.
So in Tampa, Florida, if you have a patient load, like monthly patient load of 10 patients, your ROI is a little less than 6 months. We typically see a larger patient load than that, but with capital medical equipment, a return on investment for a doctor of 12 months or less is a wonderful value. So we think we've really hit a solid niche with
I
this.
see that. I see that. I think it's a great tool and a definite asset. Thank you so much.